We're really at a crisis right now when it comes to unsheltered homelessness in our community. We've had, over the last 5 years, about a 300% increase in persons who are unsheltered and homeless. So this has reached a real health crisis level within our community that needs to be resolved. So much of the last 40 years of homelessness we've spent managing homelessness. We haven't spent solving homelessness. Pueblo Community Services has been serving people in Pima County since 1996. We focus on homelessness in a few different areas, one being veterans who are leaving facilities such as the psychiatric hospital or emergency room who are homeless. We serve folks who are coming out of incarceration, jail, prison, and then people who are living on the streets who are unsheltered and homeless in our community. But the string that kind of pulls it all together is homelessness. So people get help from OPCS typically through our outreach team, which is out in the community. We have an integrated medical and physical health and behavioral health outreach team that's out in the community every day, and housing navigators that help people get into shelter and into permanent housing. OPCS is different in the sense that we do adhere to the Housing First model. They're not going to be able to work on their mental illness if they don't have a place that they're able to stay where they're safe and they know that they'll have their basic needs met. Next year we'll be opening the Center for Housing First, and the Center for Housing First is the epicenter for growth of Housing First within Tucson. So the Center for Housing First will allow us to increase the amount of Housing First services within Tucson by about 40%. That includes employment, case management, behavioral health services, everything people need to be able to get off the streets, get into an apartment, and stay in that apartment and be successful. So when people move into their own apartment, that's not where it ends. We have permanent housing case managers who are out there who are helping people be good tenants, number one, and then to improve their health and wellness and to monitor their support and their needs. So someone might be with us 2 weeks, they may be with us 60 days, they may be with us a year in one of our shelter programs. They should leave when it's the right time for them to leave and they're going to be successful. And it's really a matter of opportunity. It's not so much that we have to change someone, we just need to be able to provide the opportunity and the ingredients for them to change. There's a few different ways that you can support OPCS in our work. One is to donate. You can give on our website. The other one is to help with our volunteer services, getting things out and the needs that people have in the community. And the third one is that you can become more educated and advocate for the Housing First model within your community. You can find out more about us online or check us out on social media.